Before administration, all plasma products must be tested for which of the following? A. ABO compatibility. B. RH compatibility and ABO compatibility. C. RH compatibility. D. None of these are correct. The answer is B. RH compatibility and ABO compatibility. Before administration, plasma products must be checked for ABO compatibility and RH compatibility. ABO blood type does not have to be an exact match, but blood types must be compatible. An RH positive individual, for example, is compatible with either RH negative blood or positive blood, while an RH negative individual is only compatible with RH negative blood. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. Where would the nurse listen to evaluate the pulmonic valve? A. The second left intercostal space. B. The first left intercostal space. C. The first right intercostal space. D. The second right intercostal space. The answer is A. The second left intercostal space. The pulmonic valve can be auscultated to the left of the sternum at the second intercostal space. Auscultation at this space can aid in the identification of pulmonary murmurs such as pulmonary stenosis or regurgitation. The second right intercostal space is the location at which the nurse would be able to evaluate the aortic valve. The first intercostal space is not generally auscultated in a normal heart exam. A nurse is performing standard cardiac auscultation on a 47-year-old male with normal heart size. The nurse pauses to listen at the fifth intercostal space on the left midclavicular line. The nurse is evaluating which of the following? A. The mitral valve. B. The pulmonic valve. C. The tricuspid valve. D. The aortic valve. The answer is A. The mitral valve. The fifth intercostal space on the left midclavicular line is the best location from which to evaluate the mitral valve. The other heart structures are paired with locations as follows. Aortic valve, the second intercostal space right of the sternum. Pulmonic valve, the second intercostal space left of the sternum. Tricuspid valve, the fourth intercostal space left of the sternum. A nurse administers 1 unit of packed red blood cells. 4 to 6 hours later, what change can be expected in the patient's hemoglobin levels? A. 5% decrease. B. 3% increase. C. 20% increase. D. 15% increase. The answer is B. 3% increase. A nurse should expect to see an approximately 3% increase in the recipient's hemoglobin 4 to 6 hours after the administration of 1 unit of packed red blood cells. Which of the following has been removed from washed red blood cells? A. Plasma. B. Antibodies. C. Platelets. D. All of these are correct. The answer is D. All of these are correct. Washed red blood cells are the product of blood that has been stripped of plasma, leukocytes, antibodies, cytokines, and platelets, in addition to any other blood proteins.